Good morning, my dear students. Today, the very important topic I am going to discuss, that is the role of a doctor in poisoning cases. I have already discussed regarding the definitions of toxicology, toxinology, father of forensic toxicology, toxicity grading of the poisons, what is the definition of poison. So, you must remember these things, because the toxicology chapter will be a different chapter in 5th semester as well as the second professional MBBS. I have already discussed, and when in the practical aspects the every poisons is given to you, suppose the 2 or 3 poisons is given or the question is asked, then the examiner definitely asks you what is the definition of poison. Now the 5 marks question is very important here, 5 marks question here, that is the role of a doctor in poisoning cases. So, from the general aspects of toxicology, it is asked by the examiner what is the role of a doctor when he is going to treat a poisoning cases patient. So, now assessment of the condition of the patient. So, first headline will be the assessment of the condition of the patient. Under these headlines, you have to write down the removal of sources from toxic exposure. Means, if the source is there, suppose there is huge gas leakage, air pollution, there is burst or the bomb burst is there. So, you have to remove the sources from the toxic substances. Next is the first and foremost duty of our doctor is to save the life of the patient and treat the patient accordingly. Third, if the patient is going to die, suppose it is a very fatal condition and you presume that it is the last stage or gasping stage, the patient will not survive at all, then you have to prepare the dying declaration without any delay, because we do not know what type of poison he or she is exposed, whether he has taken or whether he is exposed or he is injected, we do not know. So, it is unknown case of poisoning and we have to determine after that. So, dying declaration is very important. Next, fourth point, here it is written 5th, but it will be 4 and it will be 5. So, the removal of the unabsorbed poison from the body. So, the fourth point will be the removal of the unabsorbed poison from the body. Suppose I have taken, or some people has introduced some poisons mixing with the drinks or foods and I have consumed these things. So, in any form, if it is ingested or it is taken, so it enters into the stomach if it is taken orally, then it cannot be absorbed very quickly. Suppose it is a solid food, it is a food that is mixed with the lipid substances, fat is there, so it cannot be absorbed in the blood or it cannot enter into the circulation instantly. So, some amount portion that should be unabsorbed, undigested portion will be there. So, you have to remove as early as possible that unabsorbed substances or the poisons from the body, because so that it does not enter into the systemic circulation. So, you have to remove the unabsorbed poison from the body. Suppose I have taken some 8-10 tablets of benzodiazepines, like the diazepam tablets. So, it cannot be digested within 30 minutes or within 15 minutes. So, if it is happened that and it is told that I have taken unknown poisons and I have shifted to the hospital, definitely some portions of the tablets will be present within the stomach. So, it has to be removed from the body as early as possible. So, how? By inducing vomiting, so that from the vomitus it will be coming out. You have to give some emetics drugs so that I am able to vomit and it will be coming out through the mouth, as because it is an unabsorbed portion, it is not digested. some particles are present within the GI tract, within the esophagus, within the stomach also. And you have to give the stomach wash. Nowadays you know that the stomach wash or gastric lavage is very important short question, that is the stomach wash or the gastric lavage. It is very helpful to remove the unabsorbed poison from the body, basically from the stomach. And bowel wash, sometimes the bowel wash, if it is given, suppose it has entered into the intestine also, so you have to give the bowel wash so that it should be removed through the bowel. Now, the removal of the absorbed poison, definitely some portion will be absorbed through the gastric mucosa, or if it is injected into the body in the subcutaneous route or in the intravenous route, intraarterial route, intradermal route, so any route, if or it is exposed to the body surface area or direct contact with the surface of the body, so it should be absorbed through the vessels of the periphery, capillaries, or within the blood vessel into the systemic circulation. So you have to remove these poisonous substances which is already absorbed in the body. How? By forced diuresis. By forced diuresis, so that through the urine it should be excreted. You know the metabolism of drugs. So renal excretion, first degree metabolism, first pass metabolism. So you know these things. So forced diuresis, so that through the urine the drugs will be coming out which are not able to metabolize within the liver. Hemodialysis, you have to done hemodialysis so that the toxic substances which are present or mixed with the blood, they should be filtered, that should be removed. Like you was watching, the hemodialysis is done in case of renal failure patient, so that the creatinine clearance will be good. Hemoperfusion is very important language. Peritoneal dialysis, hemofiltration, and plasmapheresis. Plasmapheresis. So plasma filtration will be there, because in different types of poisons are there, they are entering into that type of body tissues basically. Some portions they are entering into the kidney, some portions they are entering into the blood, some drugs of the poisons which are entering into the plasma, some drugs they are entering into the peritoneal spaces. Peritoneal dialysis should be done. So these are the methods by which we are able to remove the unabsorbed poison from the body. Examiner asks this type of question: tell me some steps where the absorbed portion of the poisons are removed from the body. So you have to say, sir, we can remove the absorbed poisons from the body by means of forced diuresis, by means of hemodialysis, by means of hemoperfusion, peritoneal dialysis, hemofiltration, and plasmapheresis. Next, examiner will ask you, tell me some steps by which we are able to remove the unabsorbed poison from the body. Then you have to say, sir, by inducing vomiting, by giving some emetics drugs like these things, natural emetics or some drugs, gastric lavage, bowel wash. So these will be your answer. Next, you have to give some drugs which counteract the effects of the poisons. Means if I have taken some specific poison, and if it is available that some drugs or medicines are available to counteract the action or the sign symptoms of the poisons which I have taken, so that it will neutralize. So this is called antidote. Antidote is nothing but the substances or the materials which are used to counteract the effects of poisoning. Next, your role is to inform the police as a doctor, because we don't know whether it is a suicidal poisons, whether it is a homicidal poisons, or whether it is accidental poison basically. So it is because it is unknown case, unknown poisoning. So if the patient will die in poisoning, so the post-mortem examination should be done to confirm the which type of poisons it is taken, whether there is any motive behind these things of suicidal or homicidal, or it is accidental case. We don't know. That's why we have to inform the police to perform the police inquest, and you also issue some medico-legal case issue or the police information report. Police information report, when you are able to attend in the future in the emergency room, then this type of patient will come, and it is the role of a doctor to perform or write the medico legal case MLC. It is called medico legal case MLC, or medico legal issuing certificate to the police. Next, to confirm the nature and the character of the poisons, he should collect the stomach wash, because if it is taken by the oral route, so you have to take the stomach wash, content of the stomach wash, vomitus, stool, urine and blood, because we have to send in the forensic science laboratory, so that we are able to confirm that which type of poison it is present within the body. That is why we have to collect the samples basically and preserve and send for chemical analysis to the forensic science laboratory. The doctor should maintain the case record and detailed history of the patient. Basically, it is very important. We do not know whether it is a suicidal case or homicidal case or accidental case. So, the case record history regarding this issue, you have to record these things as a medical records, MR, medical records. So, you have to take thorough history from the patient party also. Next, follow up with the effects of treatment. When as a doctor you are treating the patient, definitely you have to follow up the patient. Suppose the person is recovering and you have discharged the patient, that patient is quite well. But after recovery, again the sign symptoms is developing, because some poisons which are long acting poisons, which are secreted from the body later, we will discuss one by one the different characters and the properties of the poisons. Some poisons they are very short acting, some poisons they are long acting, some poisons they are secreted from the body itself through the mucous membrane or the body secretions, mucous glands also. So, you have to follow up the patient after discharge, whether another sign symptoms is developing or not. Next, psychological counseling, because you know most of the suicidal poisons, the persons who are taking the poisons for the purpose of suicide, basically the persons are suffering from psychological disbalance in the form of depression. Nowadays it is happening. The increased case records are there that the persons are psychologically imbalanced, mental illness is there, depression is there, and taking the poisons for committed suicide. So, psychological counseling should be done if it is a case of suicidal poisoning or a poisoning attempt of suicide. Next, discharge and follow up, which I have already told you. Now, some laws which are related with the poisoning, it only the short question sometimes it is asked the laws related to poison. The laws related with the poison. What are the laws? One law is the Drug and Cosmetic Act 1940. Just remember the names. Drug and Cosmetic Acts 1940. This year is very important because all these things associated with the year timing. So, the Drug and Cosmetic Acts 1940. Next, the Drugs and Cosmetic Rules 1945. So, that was Act, now it is Cosmetic Rules 1945. Next, the Pharmacy Act 1948, the Drug Control Act 1950, the Drugs and Magic Remedies Act 1954. Next, the following particulars you have to note when you are going to treat the patient of poisoning cases. The serial number of the poisons, if it is available. So, some patients they are carrying that poisons, doctor, this type of poisons has taken by the patient. So, you have to write down the serial number which is written in the bottle shield label. So, serial number. Next, the date of supply. So, when you are going to treat the patient like the pharmacy or etc., you have to note down in the strip or in the poisons shield bottle the date of supply, the number and address of the prescriber. You have to see the prescription who has prescribed these poisons, name and description of the patient and the address, name of the drugs or the preparation and the quality of the patient as well as the quantity of the medicines, name of the manufacturer means who is the manufacturer, whether there is some laboratory they are preparing, some pharmaceutical companies they are preparing this type of drugs, whether it is approved by the US FDA, United States of Food and Drug Alteration Act. So, you have to know these things, otherwise it cannot be given, because the trade license should be there of the drugs. So, US FDA approval should be there for the international purpose of selling the drugs by the pharmaceutical companies or the laboratories. The name of the manufacturer, batch number, date of expiry of the potency, basically date of manufacture, date of expiry, signature of the qualified person supplying these medicines. Now is very important short question you have to know, that is called NDPS Act. NDPS Act. What is the full name of NDPS Act? That is the Narcotic Drugs and Psychotropic Substances Act. Suppose you have gone to a pharmacy or a medicine shop and saying that I am suffering from fever, give me paracetamol. So, without prescription they also will give you the paracetamol tablet. But if you want to take the narcotic drugs and psychotropic drugs without prescription, legally it cannot be given by the medicine shop people to you until and unless the doctor will prescribe it. So, that is the NDPS Act 1985. So, that was the existing laws, strengthening of the existing laws, controlling the overdoses and the abuses of these drugs, enhances the penalties of the illegal trading or the offences. Suppose some opiums, cannabis, ganja, bhang, choros. So, these are the things, heroin, these are the things the persons they want to do this illegal act basically by selling, by importing, by exporting these things. So, for the penalties of this illegal trading, these acts 1985 is done. Provision of implementation of the international conventions. So, it is also written there. So, narcotic drugs and psychotropic drugs. Narcotic drugs basically I have already told, the coca leaf, cannabis, opium, poppy seeds, heroines. So, these drugs there should be some control so that the illegal act should not be done. Psychotropic Substances Act, the psychotropic substances may be the synthetic derivatives, may be the semi-synthetic derivatives, may be that substances which are natural. So, in these situations also you have to strict the control and regulation of the drugs regarding the supply as well as the demand issue under this Act, NDPS Act. Now, some IPCs or Indian Penal Code, they are associated with this toxicology within these criminal laws. You have to know. So, section 176, 193, 201, 202, 284 IPCs are there. Under these things, through 72 to through 76 IPC deals with the adulteration of food and drugs. You know the community medicine, the food adulteration. So, Food and Drug Adulteration Act, it is punishable under law under section 272 to through 76 Indian Penal Code. Now, its very important thing is section 284 IPC. Whoever causes the hurt or injury with rash or negligent conduct with respect to the poisonous substances shall be punished with imprisonment up to 6 months with or without fine, and fine should be 1,000. Under section 328 IPC deals with the administration of any poisons, whether it is stupefying poisons or intoxicating substances, with the intoxicating agents, with the intention to cause hurt and facilitate the commission of an offence. This punishment should be the imprisonment up to 10 years with fine. So, you must remember these two IPC. Now the poison information centers. Sometimes the question is asked, name some poison information center. So in India, the poison information center are present in the AIIMS New Delhi, which is established in 1994. All India Institute of Medical Science, New Delhi, that is the head office of this poison information center, which was established in December 1994. Next, the National Institute of Occupational Health, Ahmedabad. Next, the regional center are located in the Chennai and Kochi, that is called the Amrita Institute of Medical Science, AIMS. So these are the poison information centers. So in Delhi, AIIMS, Chennai, Ahmedabad and Amrita Institute of Medical Science. Then the examiner will ask you, have you listened any kind of poison information center that is available at West Bengal? Yes, sir. In Arjigor Medical College, now the poison information center has opened recently. Your answer will be like these things. Now some software packages are there, that is called the Poisindex and Intox, that is the WHO. They are giving the huge information regarding these poisonous substances. So all the software data are available regarding these poisons. This software is called the Poisindex software and the Intox. So this is the Micromedics. Poisindex is from the Micromedics, it is taken, software companies, and Intox from the WHO. They are providing the huge information regarding these poisons. They have given also their contact number. If the person is suppose infected or affected with this poisoning case, they are able to take any kind of information and help by call these numbers. So it is very important. Now the prevention from poisoning. How will you prevent from poisoning? So the poisoning prevention is very important. You know that the prevention is better than cure. So you have to prevent from the exposure or cases of poisoning. So education is very important. You have to educate the people. You have to keep the poisons in a locked cabinet or within a locker, so that it is not exposed easily to the environment, to the society, to the peoples, to the children. Keep the poison separately from the food, so that it cannot be mistaken and can be taken as a food. So that misunderstanding should not be there. So you have to remove the poisons apart from the food. Kept in the original container. Keep the bottle properly closed. So the bottle where the poisons are there, that bottle should be properly sealed, properly closed. Labeling should be there before using these drugs. What type of poisons it is, what is the name of this poison, what is the expiry date of this poison. So everything should be written there. No drug should be given or taken in dark. After expiry, that drugs or the medicine should be disposed in a safe manner. You should not take after its expiry. Purchased child-proof packaged drugs only. Children should be taught not to eat the plant or the berries. Whenever cooking gas is used, wherever the cooking gas is used, the adequate ventilation should be provided. Nowadays, you know that the cooking gas is there, liquid gas is there. So adequate ventilation should be there if it is exposed. Special care should be taken in the suicidal tendencies persons for the psychological counseling. Air pollution should be prevented in chemical factories. You know that the occupational hazards, coal mines, industry, where the air pollution is much more. So that should be prevented. Safety equipment provided in factory workers, safety equipment should be there. So today's class I am finishing here. So next class I will discuss the later part. So just go through the book, because it is a huge topic. You have to take a vast knowledge regarding this poison, because it is related with the medicine. It is not only the forensic medicine, it is also the general medicine. So you have to know in details regarding these substances, how will you treat, how will you diagnose, what will be the signs, symptoms, In case of unknown poisoning, what will be your treatment protocol? So all these things you must know. So you study thoroughly the book. Okay, thank you.